It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. As I've been telling you for years, we're really growing in the Greater Hazleton area, particularly in our health department, the Greater Hazleton Health Alliance. Every week there's something new happening. Boy, they're surprising me. We just did a great show at the Wellness Center, and a lot of great doctors coming into town. Today we have one of those great doctors, Dr. Cynthia Lipinski. She is a board-certified family practice physician. Now, folks, today's show we're going to learn a couple things about what she does, particularly in the area of advanced wound care, which is interesting. So without further ado, I'm going to introduce Dr. Cynthia Lipinski. How are you, doctor?
I'm good, thank you.
Hey, welcome to our area.
Thanks.
How do you like it?
I do, I love it.
Well, you're sort of a local girl, right?
I am.
Where are you from?
Originally from Brockton area, which is outside of Tamaqua. Went to Tamaqua High School.
What's the name of the town?
Brockton.
Brockton.
Brockton, yes.
Now, I heard that before.
You've heard of that one?
No, wait, I thought you said something else.
I did, yes. I live in Kambola now.
Ah, you
From
see,
one
you
big
changed
town
it
to
now.
another.
Okay,
Yeah,
okay.
very small towns. Very
Kambola.
small towns. Yes, Kambola.
Okay, and now, all right, so you were born and raised in that area?
Mm-hmm, yes.
And went to?
Went to Tamaqua through high school. Went to Penn State, Schuylkill campus for 2 years, then main campus for 2 years. Medical school in West Virginia, osteopathic. Residency training in Allentown, and back to Pottsville to work for a few years, and now I just moved here to Hazleton.
Well, you know, as I said to you before, you know, God bless you. You look like you're about 18 or 19 years old. You look.
Thank you.
Know, so, and you have a little girl, or a little boy, right?
A little boy,
Hunter?
yes, Hunter.
How old? 2.5.
2.5.
Okay,
Yeah.
that's great. Well, you know, when you were in high school, or when did you decide you wanted to be a doctor?
Well, that's funny. If you look at the elementary school yearbook in 6th grade, they asked us what we wanted to be, and even back then I said I wanted to be a doctor. So kind of always known that's what I wanted to do.
And so, what field did you?
Always family practice.
Yeah.
Always family practice.
And why?
You get to take care of everybody that way. Kids, the elderly, the whole family. You get to kind of be a part of that family dynamic that happens with patients and families.
What's the most intriguing thing that you see? Because you're a young doctor, but certainly have experience. I don't want people to think that you don't have experience.
Yes. Most recently, most of my patient population is probably, you know, young adults, and then sort of grows from there as far as them bringing their kids and their parents, and I get a lot of that family dynamic. So I see a lot of the start of the chronic diseases, you know, the diabetes, the high blood pressure, cholesterol type stuff. I'm seeing that at the beginning, trying to help people to prevent that from getting on to further complications, heart issues that could develop down the line.
And you're talking young adults here.
Young adults, yes, yeah.
And what ages?
Yeah, typically we start seeing this stuff 20s, 30s. We're going to start seeing some things, usually high blood pressure. There's really no symptoms of high blood pressure, so usually that's where we're going to start picking up some of these things with the high blood pressure patient. Then you talk about family history, which is very important, and you'll find out mom or dad had high blood pressure, maybe one of them has diabetes, and you go down that road and you'll start screening people. Talk about diet, habits, exercise. Most people in this country don't have a good diet, don't do much exercise, so it's a good starting point to realize what you're doing now and what you could change and improve on for future so that you don't develop those chronic long-term issues.
You bring up an interesting point, doctor. This morning I was having breakfast, and there was a young gentleman sitting next to me who he has to be probably in his mid-20s or, you know, 28, 27, and he had a great physical exam, except his blood pressure was high. And what he said was family history.
Right.
Okay, and I guess, you know, what you're saying is interesting, because even young adults, okay, because they think they're immune to anything, as
Right.
we all know.
Sure.
I'm only 42.
Of course.
Yeah, right. But it's imperative that, you know, don't think because you're in your 20s
Right.
that you should not go for a physical exam.
Exactly. Yeah, the importance of an annual checkup is really important because of that. You might have something going on starting that you don't know about. And when you wait till you're in your 40s or later, or just, I don't like doctors, you hear that excuse a lot, you're putting it off. You're already past the point of stopping the process and improving it, making changes so that you don't go down that road and have to be on the 10 medicines that nobody wants to be on. You can make those changes early and not need to go through all that stuff later.
You know what fascinates me is, and you're looking at the biggest baby, okay, when it comes to that, because I'm the biggest baby. It took me 3 years to get a colonoscopy with Dr. Imula. And when I went, it was like a piece of cake, and I highly recommend because it's important. But
Sure.
someone tells you have something like, oh God, I'm done, I'm going to die,
Right.
okay? Because men are big babies. However, with that being said, I think the preventative medicine, which is, or preventative care, is extremely important today.
Yes.
And particularly, like you said, the young adults today, especially women or couples, maybe in their late 20s, early 30s, that have a child or two. They're out working, they're busy, two of them are working, you know, they feel good, who's smoking, who's drinking, who's who's eating fast food and all this other stuff.
Right.
And those things happen, okay, that really should not happen. I did something that I shouldn't do. Should be shutting my phone off here. Jane's going to yell
That's
at me
okay.
now, I know. But anyway, what do you think, what do you think about that? In terms of, you know, those people who are out there who know they are, what should
Sure.
what should they be doing?
What should they be doing? Well, first of all, you should certainly have a family practice physician that you're seeing. And know your family history. That's very important. A lot of people, they come in for their visit and you ask them questions about their family history. And family history really is just your immediate family. Those are the most important pieces. Yes, those other pieces count, the aunts, uncles, grandparents. But your family history, really what's most important is mom and dad, brothers and sisters, and children. If there's a major medical issue with one of those, that's something that is important to know. You mentioned, your colonoscopy, colon cancer, very prevalent in families. So if there is a family history of colon cancer, your recommended screening age actually is earlier than
What
the
age?
average population. Typically, the average age is 50
Yes.
to start screening. If you have a first-degree family member with colon cancer, mom, dad, brother, sister, your screening starts at 10 years prior to the age at which that family member was diagnosed. So if that person was diagnosed on their first colonoscopy at 50, now your screening is at 40.
And family history is extremely important.
Yes.
Okay, if you have a history of diabetes or high blood
Very
pressure,
much.
etc., it's really important. So I would
Yes.
highly recommend, folks, for those of you who think that you don't need a physical exam, boy, I'll tell you, I feel sorry for those people who just keep putting it off, and then when something does happen, it's
too
well,
late.
It's maybe too late,
Yeah.
or it's
More involved.
More involved,
Yes.
exactly. I said something interesting about. Well, I'm going to ask you another question. You know, we for years, Doctor, I've been advocating, even before it became the Greater Hazleton Health Alliance. We have in this area fabulous doctors. Okay, and I know sometimes some people may go and they have a bad experience. Well, if they want to talk about bad experiences, we do shows in Philadelphia, Allentown, and major hospitals. And I could write stories about a lot of things. We're very fortunate to have the doctors, and we're very happy to have you in our area.
Thank you.
But we have great doctors here, and they come here for various reasons. Okay, what was your reason why you came here?
Well, like I said, I worked in Pottsville for a few years, and when I realized I needed a change, I wasn't really improving enough there, I don't think, with the population that was there. It's a little oversaturated with physicians in that area, for family physicians. Started looking out and seeing, what was available, what was out there, where there was a need, and I saw how much this area was expanding and how much services they're trying to bring and what's going to be available to patients in this area, and it's just great. It's great, all the stuff that, the cooperative that they have between the specialists and the primary care physicians and how they're communicating and taking care of patients in a collaborative effort so that you're really getting the best care that you can.
I tell people that. I mean, it's amazing. I mean, we just did this, I told you, the show at the Wellness Center, and we just touched on the physical part, the therapies, and it's just fantastic what we have available. People are coming here, it's like you, people are coming from the areas up to our area. Now, you specialize in advanced wound care.
Yes.
Now, what is that?
Advanced wound care is for people who have chronic wounds. Chronic wounds, any wound that's been there for more than 4 weeks, typically. And those can be diabetic ulcers, they can be pressure sores, bed sores, venous ulcers just from poor circulation in the legs, any kind of open wound sore that's been there for a long time and is not really responding to conservative treatments that you would get from your family physician or specialist. If it's just not responding, that's considered an advanced wound. So those wounds we, of course, take a look at, try to figure out what's the cause of the wound, whether it is from diabetes or it's from a circulation issue, what's the cause, and what kind of modalities or changes can we do to improve that wound. And there's a lot of them. There's a lot of different things out there, and a lot of this can still be conservative. I mean, we're not usually talking about surgeries here or things of that nature to get these wounds to heal. It's just different types of specialized dressings or ointments or things that can be put on these wounds to help improve their healing, but it usually needs special attention and treatment. So typically those people are actually seen once a week just to improve these wounds. You think about most physicians' offices, you're not going there every week. You're going there for your checkups, you're going there, every couple of months maybe, once a year, depending on what's going on. But when you have a wound like that that's been there for a while and isn't healing, it really does need special attention, and that's what's offered with advanced wound care.
And primarily they come from diabetes, or?
They can be diabetes. They also can be circulatory issues. Both arterial and venous can cause issues with wounds. Swelling is a big thing. People who have a lot of leg swelling, edema in the legs, can get tissue breakdown, which causes a harder environment for these wounds to be able to heal.
And so you've been specializing in those. Okay.
And we do some hyperbaric oxygen therapy with these wounds as well.
What is that?
Hyperbaric oxygen is basically oxygen under pressure. So it's a big tank. It's a big glass tank that you lay in.
Don't scare me now.
Now it's big. There's some room around there. It's not right over your face or
Okay.
anything.
So you
it's
sit in
a
this
space.
glass tank, okay.
You're in a glass tank. They close the door. Oxygen is fed in through there, and then it's taken down like a pressure, basically as if you were scuba diving.
Okay.
So it's oxygen under pressure. And the
So
purpose of
there's
that,
no water or anything?
no water.
You're just sitting in
You're
this
just in this glass tube. There's a
Okay.
television for you to watch and a
Okay.
phone you can talk to,
Okay.
anybody. There's always somebody in the room. You're never
and
by
your
yourself.
hand to hold in case they need to hold
That's
your hand.
right. Somebody's physician is always there present.
And so what does this do then?
This it gives oxygen at higher concentrations with that pressure, gets it into that wound base. With any wound that's been there for a long time, you're going to have, potentially bacteria in that wound. You're going to have inflammatory enzymes in there from just the cause of the wound and the body trying to heal itself with that wound, and free radicals. So free radicals we've known for a long time respond to oxygen treatment, but under pressure, it does an even better job of getting that wound to heal. It's still a slow process. Of course, those wounds didn't get there overnight usually, and we're talking about something that's been there for a month as it is, but it does help and improve that along with the other modalities. A lot of times you do have to debride the wounds, get some of the dead tissue out of there. Most of these wounds are not painful, surprisingly enough. They may look very bad and look like they hurt, but most of them really aren't painful.
Have you had success with this?
We have.
Okay.
We've had
What
some very
about
good
diet?
success.
Is diet also a factor?
Very important, especially with the diabetic patients and those wounds, because the sugar control is very important. So following the diet, making sure you're taking the medications and keeping the sugars as well controlled as you can is very important at improving the wounds and helping them heal.
Okay, so if I have something, a wound or something that I feel I need, do I have to go to another doctor to get referred to you, or can I just call you?
Just call.
All right.
Yep.
And folks, her number is 501-2305. Is that correct?
Correct.
501-2305. She's in the medical office right across from St. Joe's on Church Street. If you just tune in, you're watching the Sam Lesante Show. It's a GHHA special with Dr. Cynthia Lipinski. She is a board-certified family practice physician, and we're very happy to have her in the fold in the family. So that was something you're specializing in,
Yes.
wound care. Okay. Now we are coming into the flu season. I personally do not get flu shots. Okay. And tell me why I should, because I have not had a flu shot.
Well, tell me why you don't get a flu
Because
shot.
I don't want to get.
You don't wanna get the flu.
I don't want to get the flu. Okay.
Very common reason for people to say they don't want to get the flu shot. Last time I got it, I got
Don't yell
sick.
at me now, because
I'm
I have
not
Benyo doing that. I don't need you to. Okay. So why?
Not yelling.
Okay.
Very common for people to say, the last time I got the flu shot, or everyone I know who gets the flu shot
Got
gets sick. Very common. There is a side effect, a potential that you will get a flu-like illness when you get a flu shot. Usually it's very mild. You can have a mild fever, maybe a mild cough. Usually only lasts 2 days if you're having a side effect from the flu shot. You will not get the full-blown flu, which could take weeks to recuperate from. Why is it important to get? Typically, the most at-risk people need to get the flu shot, and the most at-risk people are the very young and the very old. Those are the ones that really should be getting that flu shot.
The very young.
Very young and the very old.
Very young, and what ages?
6 months is the youngest that you can get the flu shot, 6 months of age.
You're kidding me.
Under 6 months, they don't give it, but 6 months of age is the first.
To what age?
That is till whenever. Basically, they changed recommendations back when H1N1 was out a couple years ago. that everyone should get the flu shot. It was a blanket recommendation from the CDC. Everyone should get the flu shot. The elderly, of course, are at higher risk. Their immune systems aren't what they used to be, so they, of course, are also recommended to get the flu shot. Anyone with lung condition, asthma, COPD, smokers, always should get the flu shot.
Especially the smokers.
Especially the smokers, yeah. Anybody with a compromised immune system should also get the flu shot. So anybody who's had an organ transplant that's on anti-rejection medication, people with HIV or AIDS, those people should all have the flu shot because they're more susceptible to getting the flu. And not only are they more susceptible to getting the flu, they're more susceptible to have the complications from the flu. They can develop pneumonia, end up hospitalized, and have more problems with that.
So what do you hear about this flu season?
This flu season, not hearing too much yet. It's just early. Flu season is just starting. Flu shots are usually started to be given out usually mid-September, October. And the flu season itself in our area usually comes more December, January, February.
Is it too late to get flu shots?
Not at all.
Is it ever too late to get a flu shot?
Not really.
Okay.
Typically, you're not giving it into spring. So past March, no. But like I said, typically you want to get it before flu season comes. So that's why now is the big push, and you'll see signs everywhere about the flu shot. But
what if a person's feeling healthy and they don't particularly
no other problems and they don't think they need it?
Yeah.
It's still important, especially if you're around other people. If you are come in contact with a lot of other people daily, you are potentially going to expose them as well.
Hence, I should be getting a flu shot.
You should be getting a flu shot.
Yeah. So you just answered my question.
See that?
I knew I wasn't going to like this shot. Okay. You're right. I should get it. My wife is a registered nurse. She says, get the flu shot.
The flu
Ah,
shot. See
Debbie,
that?
I don't need the flu shot.
Yeah.
All right. So how do I know if I have a cold or a flu?
Well, your typical cold symptoms and the flu, they're going to start out the same. You're still going to have the respiratory symptoms. You're going to have cough, runny nose, sneezing, potential fever is usually what you're going to have when you're talking about flu versus maybe your run-of-the-mill cold. You can still have a fever with the run-of-the-mill cold, but you're going to have a fever with the flu, usually mild, maybe up to 102. Body aches, fatigue, that's going to go along more so with the flu. Not really having the energy, you don't feel like you want to get up and do anything. Where a cold, you feel, your head is congested, you're stuffy, but you're still able to do and get done what you need to get done. That's usually the big key, that there's something more going on there.
So if you don't really know, the best thing is to go to the doctor.
To go to the doctor, yeah,
But
absolutely.
most importantly, what you're saying, doctor, is we should get flu shots.
Absolutely.
Okay, so, all right, I guess I'm going to have to get my flu shot. Jane, I'm telling you.
Maybe we could get you to do it on the show, and then you could show everybody.
Yeah,
you got the flu shot.
we did. I think one of the news people, our News 13 people, they showed
did that?
the
See?
flu shot. Doesn't hurt.
No.
It's just a shot.
And there's different varieties of it now. There's
Oh.
a shot, there's a nasal
Can
spray.
I get Roy Rogers? Well, do you remember you used to do the vaccinations?
vaccines
I
in
got
the
Roy.
shape. Did you?
Sure.
In the shape? Yeah.
Well, yeah, I'll show you. Roy Rogers.
Roy Rogers.
They lied to me.
Yeah.
I kept looking for Roy. I never saw him.
Yeah, it wasn't there.
But it's a. What do you say? There's different kind.
Well, there's a shot and there's a nasal spray, and now there's the initial shot was an intramuscular shot, like a tetanus shot, so it goes into the muscle of the arm.
Yeah.
There's a nasal spray vaccine, and now there's a subcutaneous one where it just goes under the skin, kind of like if you would have a test for tuberculosis where they put the needle just underneath the skin but not into the muscle. So there's 3 different types of vaccine now. Now, they're not all available at every location and every place, but there are different options. So people who are a little nervous about the shot maybe can do the nasal spray instead if that's what they're worried about.
So you did mention who was at risk of getting the flu.
Yes.
Okay. Now, what do I do if I get the flu, and what medication should I take?
Typically, when people are diagnosed with the flu, and there are tests that you can do to confirm that it is in fact a flu virus, but if you're pretty sure that it is the flu, when you're seen by your physician, they will usually prescribe a medication to help control the symptoms and get it gone with a little bit sooner. Unfortunately, it is a virus, so antibiotics aren't going to do anything for you as far as the flu is concerned. Rest is very important. Fluids are very important. Just supporting your body's immune system, letting it fight off the infection, which is why those people who are immunocompromised are, again, at higher risk for complications. But Tamiflu is out there. It is available prescription to help improve those symptoms.
So I guess the best thing is if you start feeling headaches, or if you start feeling, before I guess it's coming on anyway, but
Right.
what should a person do if they start feeling like they got cold?
If you're starting to feel that way, you should definitely call, get in with your family doctor, get checked out, because the sooner you start on a medicine for a flu virus, the sooner you're going to start feeling better. Typically, that medicine should be started within 48 to 72 hours of symptoms. So you don't want to wait 4 days and then think, oh, maybe this was the flu, because you can get the medicine, it's not going to do that much at that point. It really should be given pretty soon after those symptoms start.
So what's the best way to prevent someone from getting the flu?
From getting the flu. The biggest thing, of course, the flu vaccine is very important. And again, it's not only to protect yourself, but also other people that you might come in contact with. And hand washing is very, very important. All the germs that you're exposed to are typically carried on and passed on by whatever you're touching, whatever you're coming in contact with, during the day. Stores are getting better with that. They have the hand wipes out for shopping carts and that sort of stuff that you can sort of protect yourself that way. People carry around hand sanitizers in their purses and their bags, which is good, but good old soap and water is fine. Just, when you're out in a public environment, before you sit down to eat a meal or do anything that you're going to touch your face or hands, face or eyes, mouth or eyes, you definitely want to wash your hands.
So that's critical, because I think
Very much.
most people who are washing their hands. Now, do these sanitizers things work sometimes? They tell you, the stuff
They do.
rub.
They do work. Most of them are alcohol-based. So in the winter months, when it's cold and our skin may crack and we have open areas on our hands, it's going to burn if you use that stuff.
But people don't carry soap and water around with
They
them.
don't. So it's a good substitute. If
Yeah.
you're not near a sink, you can't wash your hands with soap and water, it does work, and it's great. That's definitely something you want to have if you don't have soap and water available. If the soap and water is right there, use the soap and water.
Hey, you want to make $1 billion? We could come up with a patent.
There you go.
Something we could carry around with us with soap and water, with a little thermostat or something to heat it up.
Make it warm.
And anytime
yeah.
we wash our hands.
There we go.
We call it a Cindy and Sam invention.
Perfect.
I'm telling you.
That'll be good.
Then they're going to get mad at me, GHHA, when you leave and we'll become multimillionaires.
That's true. We'll have to stay. That's not a problem.
Prevention is always important.
Yes.
Okay. Washing your hands. Okay. Taking care, and most importantly, I think annual physicals
Yes.
are extremely important.
And on the topic of vaccines, not only the flu vaccine, but pertussis, whooping cough, is also becoming more common and prevalent in adults. Kids are vaccinated against that, and even with the tetanus booster that they receive at age 11, 12, they are getting the pertussis vaccine with that. The recommendation is out there for adults to also get vaccinated against pertussis. It is included with the tetanus vaccine, and it's recommended every 10 years. So if you're not sure when you had your tetanus shot last, it's a good idea to get it updated with this pertussis for the whooping cough. Same complications can happen with whooping cough with pertussis as far as flu goes. You can still end up with a pneumonia, a very sick illness, and the cough lasts a long time with that too. So, when you're in there and you're talking to your family doctor, talk about vaccines and if there's anything else that you would be due for. Pneumonia vaccine also very important for the elderly. Typically for people age 65 and older is the key. They really want anybody 65 and older to get the pneumonia vaccine. But younger people who are at higher risk of developing pneumonia, anyone who's had pneumonia already or is a smoker or asthmatic that's not well controlled, also should be receiving a pneumonia vaccine.
So you're talking 2 shots now.
That would be 2 shots, yes.
Okay. You're not making this easy for me, doctor. You got me convinced with the flu
With the
shot.
flu
Now I have
shot,
to
good.
take another shot.
Yes.
Okay.
But it's all about prevention.
Does that hurt?
What's that?
The pneumonia shot.
They're all the same. They all go the same way. So it's a pinch, of course. It is a shot, but it's nothing.
Okay, so I'm watching the show, and Sam Lesante's talking to Dr. Lipinski, who is a board-certified family practice physician. And maybe I'd like to come to you for an exam or whatever, but I have a doctor, a family doctor. I mean, how does that work?
Well, typically, when you're trying to talk about picking a family doctor, or if you're happy or you're thinking maybe I want to change or anything of that nature, you can always go and see somebody, and sometimes the grass isn't always greener. Sometimes you're like, you know what, I think I am happy where I'm at, and that's okay. You're never obligated to see somebody after that first visit. As far as the wound care stuff goes, we do that, and you go back to your family doctor. We only do the wound stuff.
But you want to know something, doctor? There are tons of people out there that do not have family doctors.
There are.
That's
There are.
that's why I'm hoping the shows like we're doing
Yes.
and informing them, okay, there are a lot of people that just don't have family doctors. And there are also doctors who cannot take any more
True.
patients.
They're
okay?
overwhelmed, yes.
And so at least you are available
We are.
until you get really booked. Okay.
Well, even when we're, busy and full, I like to keep those openings there. I don't like when a patient calls and they want to get in for a new patient visit and it's 3 weeks of a wait because we don't have any new patient appointments. I try to keep it that we can fit somebody in within a day or 2 days always, no matter how busy we are.
I'm glad you mentioned that because sometimes people think that, you see sometimes an advertisement, no waiting, etc. Well, we have the same thing here,
Sure.
okay? Just that it all depends. Sometimes the doctor is booked that day, but they'll take you next day. In your case, I think you're going to be very busy, okay, with the knowledge you bring. I'm talking to Dr. Cynthia Lipinski, folks. She's with the Greater Hazleton Health Alliance now. Her office is up in the medical building. There's the medical office, right, Jane, up on Church Street. 501-2305 is her number. Now, just so we could go back, some people may be going through the channels, and they're popped in, they see this handsome guy and this good-looking girl, and they want to know who you are. So why don't you tell us again who you are, where you and what brings you here?
As you said, I'm Dr. Lubinsky, and I am a family practice doctor. I was born and raised in Schuylkill County, a little south of the border there, but always wanted to stay here in this area and work here, and went to medical school in West Virginia with the plan always to come back to this area. Did my training in Allentown and worked in Pottsville for a few years and looking to expand and move further with stuff, and ended up coming here to Hazleton.
And you looked at the our Greater Hazleton Health Alliance, and what was your decision why you wanted to come here?
They're really expanding. They're bringing in a lot of specialists. There's a lot of communication between the physicians, a lot of coordinated care, all-around care, so that you know that you're getting really good patient care, and that's the most important thing.
The system they have, the technology they have now, I think is phenomenal, because every doctor, even at the wellness center, have access to the full family history, so which I think is great.
Yes, it's very, very helpful when you can not have to, of course, make the patient repeat everything every time they meet somebody new, but to have that information there in case something was missed or forgotten, it can be added in, and that whole record is updated and everyone has access to it.
Every doctor, if you have to go for an MRI, or if you have to go for a physical, or if you have to go for an echocardiogram or whatever, every one of those doctors who is within the system, okay, and they have to be in the system, right, Jane?
Yes.
They have access to all that, and I think that is, the more information is, and they can resolve something.
Absolutely.
Instead of, well, I have to wait till Dr. Lesante gives me this, or Dr. Lipinski, etc. I could see you have a good passion.
I do.
For your your practice, and we wish you well.
Thank you.
I think you bring something, that we have so many different modalities that we're addressing now.
Sure.
Okay. And that's another thing, folks. If you have something that you think you have to go out of town, call the Greater Hazleton Health Alliance first and find out if they have any specialists in those areas, particularly in your area, wound care, advanced wound care. I wish you the best.
Thank you.
And come back and visit us again, okay?
Sure, I will.
Tell Jane you like to come on the show once in a while. Okay?
Sure.
Talking to Dr. Cynthia Lipinski, folks. You can contact her at 501-2305. And I had a conversation with someone the other day at one of the local restaurants when I was having breakfast, and they came up and says, Sammy, I went to this particular doctor. I was going to Allentown. I went to this doctor, and I want to thank you. I'm right here in Hazleton. We have qualified doctors, the nurses, the staff, etc. It's all here. They keep on raising the bar. So if you have any questions about Dr. Lipinski, please give her a call at 501-2305. We'll see you next time.